Thank you and good afternoon. My name is, as we've just found out, is Paul Leach. I'm Head of Transport Innovation at NHS England's transport team. And I think importantly for this topic, I'm a paramedic as well, having served 16 years in Yorkshire before I joined NHS England. So this is very much a topic that is close to my heart and my passion. Okay, so let's start with some background. As my colleagues from North East London, ICB mentioned earlier, the climate emergency is a health emergency. We recognise that in the NHS. That led us, as they mentioned earlier, to become the first healthcare system in the entire world to commit to becoming net zero by 2040. And that's for the emissions that we can control directly, what we refer to as our carbon footprint. Our carbon footprint plus is the emissions that we can directly influence, so our supply chain, fleet and logistics, our independent providers that we commission to give us services. So we're going to look to a target of about 2045 for those emissions. In 2022 then, NHS England's Net Zero Travel and Transport team, which was very new out of the packet, formed in 2022, was set the task of looking at the entire NHS fleet of owned and leased vehicles, which is about 21,000 vehicles in total, the second largest fleet in the UK. I'll let you work out who the largest fleet is, and you can ask me later, I will tell you. So we've got to look at how we transition that entire fleet. There are segments to that fleet, of course. Some of it is car-based, some of it is not emergency, some is very much emergency vehicles at the front line of everything we do. So we commissioned an organisation called Cenex, who are a not-for-profit organisation, the Centre for Excellence in Fuel Cell and Low-Carbon Vehicles, to help us develop a net zero travel and transport strategy. That strategy was published in October 2023. We're very proud of it. We think it sets the direction that the NHS needs to go with to get to a zero-emission fleet. So I'm going to separate here for the emergency fleet into two halves. So first of all, we've got the smaller cars. We've got vans that are non-emergency, referred to as our rapid response vehicles. You may well have seen them around the streets of London, Ford Mustangs, and so on and so on. Actually, they're quite easy to transition because the vehicle technology is there for what we need. The ranges are appropriate for what we're doing every day, so that's quite a simple transition. More challenging then is the double crewed ambulance. This is what we refer to as the iconic ambulance that you see everywhere. And that is a huge challenge for us for a number of reasons, which I will come on to shortly. So we had to start off with a very, very detailed, to find a detailed understanding of what those ambulances actually do. I spent 16 years in the back of one. I couldn't tell you how many miles I drove in a shift. I have no idea. I just know that we did drive miles. So we had to bust a few myths, to be quite honest. So in understanding that fleet, and I will come to the detail of that slightly later in the presentation, what we came to then is our net zero travel and transport roadmap. And as you can see, there are some very key dates on there that we've got to be setting our aims for. The ones I will point to, first of all, 2027. All new vehicles owned or leased by the NHS will be zero emission. That's 2 years away. All new vehicles. Now, we're not saying we're going to get rid of any of the existing fleet early in its life cycle, but all new vehicles that we procure should be zero emission from 2027 onwards. That aligns with the government's targets as well. We treat ambulances and emergency vehicles slightly separately to that. They have to come later. So from 2030 onwards, all new ambulances will be zero emission. Again, we're not decommissioning ambulances early. They will still have their 5 to 7 year life cycle, but all new procurements from 2030 onwards must be zero emission. So why are we doing this? What's the point? We've already said, you know, it's a health emergency, but actually there are some quantifiable benefits to the NHS. So first of all, if you look at the top graph, you can see that our emissions is huge. You know, we're about 180 kilotons per year from our fleet. It's absolutely huge, of which double crewed ambulances particularly is a major proportion, the biggest emitter. It's ironic that we put our poorest patients in our most polluting vehicles. We have to do something differently. We think by transitioning then to a zero-emission fleet, we can reduce our transport emissions by 70%. And that's on the current national grid composition. As the national grid decarbonises, our emissions profile will fall as well. And obviously, exhaust air pollution will decrease simultaneously. Really important for environments outside of our emergency departments where we take our poorest respiratory patients. And quite often at the moment, unfortunately, they can spend a lot of time parked in ambulances while we get that handover. We're working very hard to shorten that handover delay. So we think to get to a zero-emission fleet, we're going to have a one-off investment of about £100 million in EV charging infrastructure. This doesn't include grid upgrades. This is the actual hardware and the installation of the hardware. And that will be both our ambulance stations and our hospital ED sites. We need to work across the entire NHS system to support the transition. And that's where our ICBs will take a very pivotal role in enabling us to work collaboratively in their footprints. £100 million is not small change, but we predict that will save us about £59 million per year. So the payback is huge. The benefit to the NHS is potentially huge. There are other benefits rather than just fuel costs and maintenance costs. There are societal and health benefits, which we've calculated through our Greener NHS programme to about £270 million per annum in monetised societal benefits. So the benefits of transitioning are absolutely huge for the NHS. To the context, you probably understand this already, but I'll speak of it. NHS sites, our estates, are absolutely rammed. They are busy 24 hours a day, 7 days a week. We need high levels of availability. Our sites are often spread quite largely across geographical areas, and the infrastructure that's in place at the moment isn't necessarily where we need it to be for the fleet. So there's going to have to be some work involved in things like the new hospitals programme, in any capital expenditure that we do on our estates to factor in the EV infrastructure that we need in future. And the NHS sites are key trip attractors. We have over 1.5 million people in our organisation. Every one of those travels to work in some way, and we've talked about modal shift. We're looking at modal shift. How do we get our staff commute to be less car intensive? Can we use public transport? Can we push cycle to work schemes? Anything like that that can reduce that carbon footprint. So in our secondary provider sites, this is our hospitals particularly, we have over 450,000 parking spaces, which is over 5% of the total national regulated parking spaces. That presents an opportunity. Currently over 4,150 EV charging points at these sites, which means about 0.9% of our car parking spaces have an EV charging point. As I mentioned earlier, decarbonising double-crewed ambulances is a particular challenge. We actually think this is the most difficult land vehicle to get to net zero because of its unique nature. It has a very unpredictable duty cycle. No 2 days are the same. So first of all, they're heavy. They're specialist vehicles. As I mentioned, the duty cycle is highly variable. Sometimes they have very long journeys. Inter-facility transfers can be from one end of the country to the other. And in the events of things such as like a major incident, they may be required to support their colleagues in other parts of the country by sending resource. So we have to be able to maintain that capability. The big thing about ambulances is they carry masses of equipment in the back. Medical equipment, heating, ventilation and air conditioning, which is a particular challenge. All those systems will need to draw power from the traction batteries or alternative systems. And they need to be ready for the next call. We cannot have vehicles parked up charging that are unavailable for the patient. It's an absolute non-starter, so that is not what we're proposing. We propose that they will only ever charge when they are stationary for other reasons. That could be a meal break, it could be whilst they're outside a hospital waiting to hand over, or between calls. We will never take them out of service to charge. And obviously there are severe consequences of us doing that. The media are always ready for a bad news story. So we've taken a data-led approach, which has three main elements. First of all, what is the duty cycle? What does it look like? How can we find out where our ambulances go, how long they spend at certain locations? Actually, ambulances carry very complex telematics systems on board. So we needed to interrogate the data that they're already collecting and use that to inform our strategy. The vehicle design itself, how can we amend that design? How can we improve that design to suit a zero-emission based vehicle? And the refuelling infrastructure. What do we need? Where do we need it? How powerful does it need to be? What's the cost? And how do we make that happen? So the vehicles itself. The BEV, the battery electric vehicle, double crewed ambulance. Actually, we've had one in the NHS since 2021. Operationally, it was built in 2020, and that's in the West Midlands. It was a retrofitted Fiat Ducato. The Fiat Ducato is the national standard spec ambulance at the moment. It gives us a range of about 100 to 120 miles on a single charge. However, the retrofitting process is extremely expensive and just won't work for a larger fleet rollout. We're currently in the second generation of double crewed ambulance that's electrically powered. London Ambulance Service have the first two of these vehicles. Within the end of 25-26 financial year, we're going to expand that fleet to about 80 across the country. All of our 10 ambulance trusts and an ambulance service in the Isle of Wight will actually have a small number of these vehicles to trial. There is definitely, at the moment, a purchase and a conversion cost. There's a cost premium. They're more expensive than the diesel counterpart. However, based on the total cost of ownership of about 7 years life cycle, we actually save money by having these new vehicles. My team continuously evaluate these vehicles. We're taking performance data every month to see what's happening with them. And again, any adverse incident means we will just stop the program and we have to rethink. Fortunately, we've got a national procurement program in place as well. So we have a contract for electric vehicles. That's given us a price advantage. So our suppliers have given us about 18% discount. They see this as a really, really pivotal contract to have, to work with the NHS and to help our transition. With an eye to the future, our third generation, it's actually not too far away. We first thought we would see these in about 2029, but the market is moving really quickly. We've got a second vehicle supplier that has already given us indications the range will increase by 50% with their vehicle. So we're looking at that through this next year. So that gives us something to sort of hang our hat on. The technology is moving very quickly. As I mentioned earlier, our world first original equipment manufacturer, fully electric double crewed ambulance. Why is it world first? Because it's the first ambulance to be built on a fully electric vehicle. Every other ambulance, whichever country you're in, has been retrofitted from a diesel to an electric, or a petrol to an electric. This was built electric bottom up. It went on its first operational shift on New Year's Eve, of all days to put a vehicle out. New Year's Eve, London are mad, in 2023. However, there have been no adverse incidents with this vehicle. The crew feedback is incredibly positive. It drives very smoothly. It is quiet. The patient care is enhanced because of that quiet and smooth nature of the drive. So they're very happy with them, and actually they're falling over themselves to take these vehicles out. The fleet will continually grow now, both within London and outside, as I've said. So we're going to expand quite rapidly this year so that every trust has experience of these vehicles. So back to the data, what does it tell us? We had telematics data from 5 trusts, 5 really, really good trusts, good data. And that showed us that the mean and 95th percentile daily mileages were 92 and 185 miles per 24-hour period, which surprises us actually. We thought they'd do many, many more miles than that. So on average, 92 miles per day. The 95th percentile busiest, 186 miles per day. And that suggests that the telematics data we have, and we've balanced that across the 5 trusts, and it's broadly representative with the Driver and Vehicle Standards Agency mileages. It's broadly representative for the whole country, so we can scale up with confidence. One of the key findings from our telematics study was that even the busiest double-crewed ambulances have their ignition switched off for 15 hours per day. 15 hours per day out of 24, the ignition is switched off. Now, that gives you opportunity for charging. Obviously, a lot of that time they're outside a patient's house. They're not anywhere near somewhere we could charge. So we had to really focus in on where the charging opportunity is. So our basic analytical process then with CENEX. Calculate the electrical energy used between every stop at an ambulance station or a hospital. Once we know how much energy they've used, how quickly would we need to charge that vehicle back up to 100%? Now, in real terms, we won't go for 100% every time. That will be unnecessary, but we want it to be absolutely risk-averse here. So every time, get it back up to 100%. And once you've got that, consider at that site or hospital site, what happens when you have multiple ambulances on site? It's a peak busy time, usually around mid-afternoon to tea time. And that let us model then what the EV infrastructure would look like on each site. You can see then from the data that the refuelling power that was required actually is fairly modest. We set off in 2022 with the assumption that we would need very rapid, very high-powered chargers everywhere. That's proven not to be the case, and that's driven down costs for the NHS, or the cost modelling, quite a lot. We use the East of England data that we've got as representative, and that showed us that 78% of all the vehicle charging required could be maintained and could be fulfilled with a 22 kilowatt-hour charger, so fairly modest in size. In the modelling, of course, there was a number of visits that we couldn't get back to 100%, even with the most highly powered charger at the moment, 350 kilowatt. Caveat to that, this is modelled. There have been no failed journeys. So if anybody's reporting this back, we haven't got it wrong yet. Okay. So to enable our trusts, particularly our ambulance trusts, to plan their infrastructure modelling, we've developed a toolkit as well. We call it the EVERIT, the Emergency Vehicle Refuelling Infrastructure Toolkit. And this allows each of our ambulance trusts to programme each site, to log in every site they've got in their estate, to build into the model the number of ambulances at peak time, and that will then predict and tell them quite accurately, actually, how much charging infrastructure they will need. And what we do nationally then from NHS England is try and work outside of the NHS to bring in the funding. So that's working with Treasury for, to try and influence the comprehensive spending review. We're working with other organisations across the government, such as OZEV, to see how we can fund this charging infrastructure rollout, how we can support that. I think that's my last slide. Thank you.